Good morning, everyone. I'm Susan Vataparampil, and I'm the Associate Center Director of Community Outreach, Engagement, and Equity at the Moffitt Cancer Center. I'd like to welcome you and thank you for joining us today for International HPV Awareness Day. This is a special day that was established to encourage people to educate themselves, their families, their friends, and our communities about human papillomavirus, HPV-related cancers, and prevention. HPV, as many of you know, is common. Nearly 80 million Americans have been infected with HPV at some point in their life. There's over 100 different types of the virus. And although most HPV infections go away on their own, there are some high-risk types of HPV that cause 6 different types of cancers, both in men and women. But the good news that we're here to share with you today is that you can protect yourself and your children against several types of HPV-related cancers through vaccination. The HPV vaccine protects against 7 different cancer-causing types of HPV and is available for children as young as age 9 and all the way up through age 45. If we could get more children, adolescents, and adults vaccinated, we can eliminate HPV-related cancers. That's mind-boggling. That's amazing. It's something that my colleague, Dr. Giuliano, Director of Moffitt Center for Immunization and Infection Research in Cancer, has been passionately working on for a number of years. And I'd like to invite her to the podium to tell us more about her work. Anna?
Great. Thank you, Susan, for that introduction, and thank you all for focusing on a very important day that is actually advertised worldwide, because this is an infection that causes cancer across populations, across countries. We're all actually susceptible to. Now, I want you to think about this. Susan used the word elimination, and I want you to think about what that means. We're talking about getting to zero cases of invasive cervical cancer. And we really believe that the United States is likely going to be among the first countries in the world to accomplish this goal, as we then spread that mission throughout the world and accomplish the global mission of eliminating cervical cancer. So think about that, getting to zero for cervical cancer. Right now, we have around 13,000 women that are diagnosed every year. Adding HPV vaccination to screening will get us to that point. But Susan mentioned that HPV causes multiple cancers in men and women. So the reality is that we may start by eliminating cervical cancer. We have the opportunity to eliminate up to 6 different cancers in both men and women. And I want to highlight one of them because one of them has been increasing in incidence quite high. So we have a doubling of the cases of oropharyngeal cancer diagnosed in men, a doubling in just the last 15 years. If we are successful with HPV vaccination, we can reverse those trends and over time also eliminate the cancers that are affecting men that are caused by HPV. Now, because of this phenomenal opportunity, what we have seen is the organization of all 70 NCI-designated cancer centers joining with us to make a call to action, to vaccinate, to screen, and to eliminate these cancers. Now, it doesn't end there, and in fact, somebody who knows this story very well, Representative Castor, who's been working with us as partners on mobilizing communities to really help reach the goal of eliminating cervical cancer and other HPV-related cancers. And with that, I would like to introduce our colleague and good friend, Representative Castor.
Thank you. Well, good morning, everyone. I'm thrilled to be here at Florida's premier cancer research center, the Moffitt Cancer Center, really one of the best in the world. Thank you for your leadership. I'm especially thrilled to be here on HPV Awareness Day because we are looking forward. We really do intend to fight to eliminate cervical cancer across the globe. And we're going to start right here in the United States, where we're doing better. But Dr. Giuliano is right. This HPV infection will have the HPV infection, but it clears itself out. But for men and women who are not able to clear the infection, you can be diagnosed with a devastating cancer, including cervical cancer in women and throat cancer and other cancers in men. Over 300,000 women across the globe die due to cervical cancer. And as Dr. Giuliano stated, over 13,000 women here in the United States are diagnosed with cervical cancer. But we now have a safe and effective vaccine that can prevent these cancers. If you went back to your family or here at the Moffitt, you're here one day and you announce, we've discovered a cure for cancer. There would be parades in the street. It would be bigger than Mardi Gras. We would be celebrating. We found the cure for cancer. Well, here is a safe and effective vaccine that can protect our children from these devastating cancers. So we've got to do all we can. And it's been the Moffitt Cancer Center over the past few years that has been the leader in the nation in bringing the other NCI-designated cancer institutes to become more active, to educate their communities. There's nothing like the Moffitt that is so in touch with community-based activities and education. But now that model has been shared across the United States. And I'm pleased to announce here today that based upon the actions of the Moffitt Cancer Center and the terrific researchers here and the folks who fight for cancer prevention in the state of Florida, I intend to develop legislation to try to meet this goal, to eliminate cervical cancer across America and hopefully take that across the globe. I also speak to you as a mother of two daughters who are both now in college. I vaccinated my two daughters when they were teenagers. This is a safe and effective vaccine, and we've got to work not just at the national level, but with our pediatricians and parents and all of the community-based organizations to make sure that boys and girls in their middle school years are getting the vaccine. The vaccine has improved dramatically. It used to be 3 doses, now it's 2. And parents, ask your pediatrician. Go to trusted sources like the Moffitt Cancer Center and your pediatricians and the nurses in your pediatrician's office to make sure that your timing is correct. But what a godsend that is, to be able to vaccinate your children to prevent them from ever being diagnosed with a devastating cancer. So congratulations. Thank you, Moffitt Cancer Center. Thank you for continuing to be a leader across this country, and I look forward to working with you on these national goals. Thank you for everyone who's participating in HPV Awareness Day.
Representative Castor, Dr. Giuliano and I want to, I don't think thank you is the right word, but we just want to really acknowledge and highlight how critical your partnership has been for us to really motivate and inspire not only our researchers at the Moffitt Cancer Center, but many healthcare providers in our community, our parents who are committed to doing the best that they feel for their children because of the efforts that you started many years ago, really visionary, before we had even had sort of the Moffitt initiative. So thank you so much. And we encourage everyone to share information about HPV and HPV vaccination on social media using hashtags #AskAboutHPV and #EliminateHPV. So thank you, everyone, and really just our heartfelt thank you to you, Representative Castor, and to my friend and colleague, Dr. Anna Giuliano. Thank you. Thank you all.